Hi, everybody. Thanks for joining us for this wellness webinar today about weight loss surgery. We are joined today by Dr. Dabbs, a bariatric surgeon, and Bridgette Paolucci, a bariatric surgery patient. We will have time at the end for your questions, so you can feel free to submit those in the Q&A box. And Dr. Dabbs and Bridgette, would you like to introduce yourselves?
Sure. Yeah, I'm Dr. Dabbs. There's a kind of ancient picture of me. I went to Northwestern for undergrad and medical school. I did my residency down the road here at Wright State University in Dayton. Board certified from the American Board of Surgery. I'm also a fellow in the American Society of Bariatric and Metabolic Surgeons and one of the bariatric surgeons here.
Hi, my name is Bridgette Paolucci. I'm a bariatric patient, and actually, Dr. Dowds was my surgeon. And I'm married, and we have four great kids. I started my journey about 4 years ago with weight loss, and it's been one of the greatest things that I ever decided to do. So.
Excellent. Well, I think at this point, we're going to be talking a little bit about some of the kind of ins and outs of bariatric surgery. Just try to go over kind of a broad overview of what it is, what it's for, who it's for, stuff like that. And then I think we'll be taking some questions later on, but hopefully I'll address a lot of this stuff for you. So if we can go to the next slide, that'd be great. So in its most basic sense, bariatric surgery is surgery that is about controlling obesity and metabolic disorders such as type 2 diabetes. In general, most of the procedures involve making the stomach smaller, leading to early satiety or essentially feeling full quickly. But there's significantly more to it than that. And at Mount Carmel here, we typically do one of two procedures. We do either the vertical sleeve gastrectomy or the Roux-en-Y gastric bypass. There are other procedures out there that are currently being done. There are also other procedures out there that used to be done very frequently and aren't anymore. So a lot of people who are interested in bariatric surgery may have heard of the lap band. That was very, very popular for a long time. Really, nobody, to my knowledge, is putting these in anymore. The side effects that were more or less unknown going into those procedures when they were originally sort of debuted turned out to be pretty bad. And the success with regards to durable weight loss what didn't justify it. And then there's some other procedures that are a little bit more specialized for specialized populations or are kind of novel and haven't got a lot of data behind them yet. So we stick with the sleeve gastrectomy and the gastric bypass because they have both been around for 20 years or more. If we can go to the next one. So, what is the purpose or what are the benefits? So, long-term durable weight loss is one of the main goals, right? So I use that word durable a lot because most people who are attempting to lose weight, it's something that they can do and have done, and then it comes back. And so a lot of treatments out there, a lot of the stuff that you would see on daytime TV commercials, they will work, but the durability of the weight loss is pretty questionable. And that's one of the main benefits of bariatric surgery compared to other methods of weight loss. And then the other aspect of bariatric surgery is controlling, improving, or even eliminating to some degree the disease states that are associated with morbid obesity, including type 2 diabetes, hypertension or high blood pressure, high cholesterol, joint pain, and obstructive sleep apnea. So, kind of common sense type stuff, but weight loss, it's not about, I'm a child of kind of the 80s and 90s. And so I remember, the big push to get away from like rail thin models on magazine covers because of what it was doing to people's body image. And I'm not in favor of ever going back, to like trying to make people feel terrible about the way they look. This really isn't about how people look. This is about trying to live a longer, healthier life with a better lifestyle, with less medical needs and less disability. So, and that is what the data shows, is that increased life expectancy, improved mental health, and quality of life are all very strongly there with bariatric surgery. And again, the durability, so 70% of bariatric surgery patients lose at least 50% of their excess weight, which is a really great number. And then the long-term durability, it says keep it off long-term 5+ years. 14 years is actually pretty normal in the data as well. So looking for qualification, we mentioned on there at least 18 years old. That is for our program. Actually, at Nationwide, they do have a bariatric program for children. But none of the surgeons here operate on children. I think that is a very specialized area of bariatric surgery. And, I think that I just wouldn't be the person to decide which person who's not an adult yet is a candidate for that. So here, at least, 18 years old, a history of attempting to lose weight and having it not work. With regards to the qualifications, based on the recommendations from the American Society of Bariatric and Metabolic Surgeons, a BMI greater than 35 means that you would qualify from a medical perspective. For a patient with a BMI greater than 30, if you have qualifying medical issues related to morbid obesity, they have type 2 diabetes on there, but also heart disease, high cholesterol, hypertension, or obstructive sleep apnea can all lead you to qualify for surgery, even with a BMI under 35. We do note there at the bottom, though, that ultimately the reality is that if you're going through your insurance, they get to make decisions about that as well. So we do use the BMI, or the body mass index, as one of the main qualifiers. And, I know there's a lot of thought out there. The BMI is absolutely not a perfect measure of anything. It is not a perfect measure of health. It's not a perfect measure of future health. There is no perfect measure. And when you're talking about trying to make a first best guess with a large population of people, this is at least a good jumping off point. So while it is, I will acknowledge that it's absolutely an imperfect scale, it's what we use, and it is very data driven and been shown to lead to good outcomes. So preparing for the surgery itself, in our program, we do an online pre-screening for folks that are planning on going through insurance. We screen your insurance to make sure that you have coverage and try to let you know that up front. Some places don't do that, but we don't want people to get surprised if they, have them show up in their office, take time off from work or whatever. And if it turns out that their insurance doesn't cover them, we want to make sure that they know that, before they start this process, because it is pretty significant. Very early on, oftentimes as your first visit, we'll have you meet with a surgeon to talk about the surgical options and go over the specifics of the procedures that we offer and which one may be the one that you would like to choose or that we would recommend, depending on what's going on with you. And then we have a period of time between that time and surgery where you meet with our nurse practitioners regularly to work on getting diet and exercise into your lifestyle. This is a requirement of all insurance companies. It's a recommendation of the ASMBS, and so we do that. We have you meet with a dietitian to discuss, the real nuts and bolts of appropriate nutrition. And then we really work hard to appropriately optimize our patients for surgery. So bariatric surgery is, when you think about it, it's very safe. It has the same major complication and mortality rate as having your gallbladder removed or doing a hip replacement, things people don't think about very much, though just these surgeries are significantly more complicated and often done on people who are much more comorbid or sicker. And part of the reason why we have such a good safety profile for these challenging cases is because of the hard work that we do on the front end with optimizing patients, making sure that their heart is in good shape for surgery, that they don't have, undiagnosed sleep apnea or undiagnosed lung disorder that needs to be managed, because all these things can increase your risks. But because of the clearance and optimization process that we put people through, our practice is very safe. We have all of our patients undergo a brief psychiatric evaluation. And then there's pre-admission testing. That's just getting ready for surgery and making sure that your labs are kind of where we need them to be. And the whole process of preparation, we say 6 to 9 months on there from the initial visit to surgery. It really depends on what your insurance company requires. Some of them require a 3-month supervised diet, some of them 6, some of them 9. And so that will have an effect, as well as the getting in to see, some of the other specialists you might need to see. But 6 to 9 months from the first visit is a fairly decent estimate. So with the surgery itself, and I'm giving a very broad overview. I'm sure there will be a lot of questions about like the actual nuts and bolts of the surgeries. But things that the surgeries have in common is that generally it's a one-night stay in the hospital. We generally recommend 4 to 6 weeks off of work. Most people who have a sedentary or a desk job could probably go back earlier. I do personally recommend to my patients they take the 4 to 6 weeks if they can get it, because it's not just about recovering from the surgery. If we were talking about just being able to get back to a standard kind of sedentary or desk job, most people could get back within a week or two, to be really honest. But we know that bariatric surgery only works as an enhancement of diet and exercise. It's not a substitute. It's an enhancement that makes it work better, faster, and with more durability. And so we know that patients will have a better outcome if they can take that time off to really start building their new habits. You've got to shop for groceries differently. You have to plan your meals differently. You have to pack your meals differently. And so there's a lot to do there as far as forming new habits before you jump right back into your job, which is probably part of what led you to be sitting in our office in the first place. It's really important that the people that you have at home with you are supportive, because again, a lot's going to change with the way that you do some of the communal activities, such as eating and preparing food. And then we have support classes, support groups and classes for our patients pre-op, post-op, always available because there's strength in numbers and experience. And then with regards to the long term, for it to be effective long term, which is the whole point, right? Because I think everybody who has tried dieting and exercising and various fads, a new thing comes out every couple of weeks, it seems. A new medication comes out every couple of years. Again, our focus is trying to be the best long-term solution, because that's what the data shows. Again, lifestyle changes like diet and exercise are absolutely necessary. This is not a substitute for those things. This is just something that makes those things work and stick. You have to have, healthy food plans. We recommend frequent follow-up. We see our patients fairly regularly for the first 2 years after surgery, and then yearly thereafter, or anytime they need to be seen thereafter. There are practices out there where you kind of get surgery and then they've done what they really want to do. So then they're not too interested in seeing you or don't have the infrastructure to see you anymore. But that's not how we do things. We do recommend lifelong vitamin supplementation. It's really nothing too crazy, but we are just trying to make sure that our patients' vitamins and minerals are well taken care of. And then we do typically recommend avoiding pregnancy for 2 years, which is kind of your main period of weight loss after bariatric surgery. It's not like anything is going to go horribly necessarily if you were to get pregnant, but it can sort of derail the process of weight loss, because evolutionarily and biologically, when somebody is carrying a baby, the body's entire biologic imperative is to hold on to calories and fat in order to help sustain the pregnancy. And so, unfortunately, just from a biological perspective, it can kind of derail things a little bit. And then for the gastric bypass, we do recommend lifelong avoidance of nonsteroidal anti-inflammatory drugs such as ibuprofen, Celebrex, Mobic, naproxen, naproxen, Aleve, Motrin, ibuprofen. There's many more of them, but those are sort of the common ones. And so this question, this is the last slide from the sort of the doctor part of this. How will my life change after surgery? And I almost feel like I shouldn't even bother because we've got Bridgette here who's going to talk to you about it from the perspective of somebody who actually knows what they're talking about. But basically, healthier eating supported by the surgery, healthy lifestyle habits supported by the surgery, increased activity, and then ongoing support from us is, what we intend. So that's kind of everything I've got to say about that for now, and I'm going to turn it over.
Thank you, Dr. Debs. So my name is Bridgette, and I'm a bariatric patient. I am 4 years out from surgery. At my highest, when I went into surgery, I was 320 pounds, and I'm down 106 pounds, which is really awesome. It took a while, but I did it in my steps the way I was instructed to, and that was amazing. I am married. We have 4 amazing kids, and they keep me on my toes, and they were the biggest part, or the biggest reason for me to have the surgery. Because I was been overweight all my life, and then I would see pictures of my kids, and I'm like, well, where was I at? I don't remember that because I wasn't there. I didn't feel comfortable going out and being out in public with them or playing at the park, and so that really it motivated me to get the surgery. So once I did, it really did open up my perspective of like, hey, I can be involved in my kids' lives. I can have a better life, a physical life, because my weight is no longer holding me down. And because of that, I also started Taekwondo. It started with my daughter going off to college and my husband needing a buddy in class. So that buddy became me. And the only reason why I agreed to it is because I had lost a significant amount of weight by then. And I felt better about being in a white suit around a bunch of teenage kids and little kids. And I didn't feel as not as comfortable, but I was still comfortable enough to get out there, practice my forms, do jumps and kicks. And that has led me to my 4-year journey of becoming a second-degree black belt. And that has been one of the greatest accomplishments of my life. It has showed me that I'm capable of not only mentally doing something, but physically as well. And I've done a lot of competitions, and I recently took home second place in sparring, which is the physical of punching and kicking at districts. And that was just such a big win for me. And I such a smile on my face. I still smile about it today because I would have never dreamed in a million years that I would be able to accomplish something like that. And it's all because of the bariatric program and my weight loss. Next slide. What inspired me again was my kids. I wanted to be active with them. I wanted to see them out and having fun like I did when I was a kid. And so not being a part of that really motivated me to be here longer because of my health. It was better because I had lost weight. I was prepared. I knew what I was getting into. They told me like, hey, this is your checklist, check this off, and you'll be right there ready to go on surgery day, knowing exactly what you're in store for between the pre-op and then the post-op and all the support you get from the dietitian and the bariatric nurses and the doctors. You knew what was coming. You knew how to prepare. And if you had a question, someone was there for you, either picking up the phone or an email to be there to support you along your journey. The biggest positive of the change in my life is that I know that I have the chance to living longer to be with my kids and possibly see grandkids. I don't think that would be an option if I continued at 320 and waited and watched as my weight increased every year. That would never have been an option. I would have significantly reduced my lifespan had I not make that step to the bariatric program. And for anyone considering the program, please do. Like, you don't have to make a commitment. Going there and talking to a doctor doesn't mean you're going to, go have the surgery. They have options for you. They're going to go over all that. They're going to answer your questions. And that is the biggest thing you can do for yourself, is this investigating, asking your questions, and preparing yourself, with education and the prep that goes into it, so you know that this is okay, that you're going to be okay, and you're going to start the most amazing journey. It could be difficult, but it's going to be well worth it in the end.
And right before we get to the questions here, I will just add that if you're considering this at all, scan that QR code. That will take you to our website. There's a pre-screening application. And on that application, it will give you the option to say if you're interested in bariatric surgery, if you are interested in medical weight management, which is medication for weight loss, that's an option as well. And then if you're just not sure, you can click not sure, and then you can have a conversation with someone about what option might work best for you. So scan the QR code and fill out that pre-screening application to find out and get started. And we can go into the questions.
Right. We did receive some questions from some of our viewers that registered online. The first one, it's directed towards you, Dr. Dabbs. Someone's asking, if I had surgery 30 years ago and then put on the weight, am I a candidate to have a second surgery?
Okay. Yeah. So in our practice, and in our program, we do see folks for revisions. It really, whether a revision can be done is not guaranteed. It's something that can be done. It's something that can be considered, but not everybody can have one. It just depends on what surgery was done, how it was done, and what's going on with your body currently. So it's a qualified yes, I guess is what I would say. And that we'd be happy to see anybody who's considering that and just try to help them discern if that's something that can be done.
Right. The second question is this safe for patients with type 1 diabetes and MS?
Yes. With the patients with type 1 diabetes, unfortunately, we won't see improvement in that the way you do with type 2 diabetes because of the differing nature of the diseases. But we can, as far as making it safe to do the surgery, that can be done with careful blood glucose monitoring. And MS is a risk factor. It's something that can make any surgery a little bit more risky, but it is certainly doable. We have had multiple patients with MS that we've treated before. And, as a side note, we found that some of the improvements that they see in the way that their body sort of feels and works is pretty helpful with their other MS related symptoms.
Great, thank you. Bridgette, I think this might be more of a question for you. What was the healing process like? And for you personally, what was the time frame after the procedure?
For me, I was lucky enough to have an office job, so I took a week off for the surgery, and then I worked from home for the second week, and then I was able to slowly go back in and set up my desk. But my healing actually went pretty well. I was very lucky in that respect. I things didn't, get bad or anything like that. I just took my time, made sure not to do any heavy lifting. You walk all the time. So that helps keep your blood flowing and keeps your body healing. So I fortunately did not have any complications, but it was pretty standard, straightforward for me.
Thank you. Dr. Dabbs, someone is asking if weight loss surgery is safe for someone with stage 4 CKD.
Yeah, it is. Obviously, with stage 4 chronic kidney disease, things are, in general, riskier. Living life is sort of riskier. So every patient who comes in and is interested in surgery, their risk may be different based on the um, medical conditions that they come in with. However, stage 4 CKD is absolutely not a disqualifier from surgery. In fact, if anything, again, I would say that it's important to consider the positive effects on that disease from undergoing the surgery and having successful weight loss and control of metabolic disorders. So, not only safe, but probably recommended.
Thank you. Bridget, this one's for you. What was your experience after the surgery? Did you experience any after effects or anything that you were not expecting?
Yeah. So when I did wake up from surgery, I did start throwing up and it continued to throw up. So it was hard to keep liquid down. They were quick to, hey, let's do these tests, see what's going on. But it really was just my body not liking what I had done to it. It was revolting. But once that settled down, I was good. I was able to get out of the hospital and go home. Only other complication I had is sometimes I can't eat certain things. They do kind of make me queasy. Even 4 years out, I can't drink hot coffee, chocolate ice cream. Some carbs can, if they're heavy in carbs, can make me a little lethargic. But I'm able to eat meat and vegetables and carbonation. Can't do carbonations, any type of fizzy drink or waters. Those are the only real side effects I've ever had. And it's unfortunate, especially with a glass of hot cup of coffee. But you could do iced coffee, decaf. You start off not having decaf before the surgery, and it's recommended to discontinue that. And I've continued that 4 years out, which is a big deal. But no other major complications, just some food allergens.
Hey, thank you. Dr. Dabbs, someone is asking, I had a lap band in 2007. How does one get back on track?
So, with that, if the patient hasn't been seen by our practice or by anybody recently, we would start by seeing you in the office. We would assess the band. We need to know how much fluid is in it, if there is any, or if it's all been removed. And you can experiment with the band, injecting fluid to try to see if we can create an appropriate amount of um, uh, decrease to the hunger drive with it. We also want to make sure it's in good position because if they have moved and they're not in good position, then they won't be helping you out very much. And then if the problem is just that the lap band is ineffectual for you, then we could talk about, would removing the lap band and considering transitioning to a different bariatric surgery be in your best interests. And a lot of that would just have to do with, how off track do we feel like we are as far as weight regain and medical conditions associated with obesity.
Um, this question says, if you cut off sugar and artificial flavoring, will that make a big impact on the weight loss?
Hmm. Artificial flavoring is not something I know any particular data about with regards to weight loss. Obviously, sugar has a couple of pretty significant effects when it's in too high of an amount. Obviously, we need some. No matter we can't cut off sugar entirely. Our brains only use sugar for energy. The rest of our body can use multiple different sources of energy, but glucose is the only energy source that our brains can use. So we have to have a certain amount. But if you cut off sugar entirely, it would, in general, there'd be significant health benefits, especially for people who are either have or on the precipice of type 2 diabetes.
Bridget, this might be more of a question for you. This viewer is asking about the support the Mount Carmel gives. But specifically, how did you mentally prepare yourself for the surgery, and how did you lean on the Mount Carmel team during the process?
So before you have your surgery, you do meet with the dietitian, and it is a several-hour meeting where she goes over what life is going to be like for you before surgery, what you should start cutting out and cutting down. And then after the surgery, you go on a diet of like liquids and soft foods, pureed food, and then you slowly work your way into the solid foods. So that was very helpful. They give you brochures, tons of recipes to get you through those first few weeks of that transition. And then they also tell you like the sizing portions and recommended things that work for other patients on containing your food and mixing it and holding on, keeping leftovers. So that really helps. And then afterwards, you can start joining the bariatric meetings. They have them on Mondays and Wednesdays, the first Monday and first Wednesday of the month, or is it, I think it might be the second one. And those are for people before the surgery and after surgery. Even 4 years out, I still get my invites. I still attend them as much as I can. Wednesdays are half days because I have Taekwondo. But you go there and they have either a PowerPoint presentation on different things that they've learned. They started working in book recommendations for self-care and self-help. And then they also do just like, hey, we're going to have an open conversation. What is everybody up to? What's some of your non-scale victories? What are some of your struggles? And new patients and old patients share their experiences and we kind of feed off each other like, hey, this worked for me. Maybe it worked for you. Hey, I found this recipe. Hey, I found this sugar-free sauce. So that has been the biggest help where I've learned the most and I keep myself motivated because other people are sharing their experiences like, hey, I'm not alone. Hey, I had something that's like this happen to me, or I found something that I really enjoyed. I'm going to share it with everybody. And that has really been the biggest support and biggest benefit of having the surgery is the before and after care, the support that you get from them.
That's fantastic. Kind of going off of that, someone is asking, what is your number one piece of advice for someone that is considering the surgery or is in the process of starting this journey?
It's scary and sometimes it can be overwhelming, but it's in the best possible way. You'd rather be really prepared for something than going in blind and not having all of your questions answered. So I think the biggest thing would just be you took the step, follow through with it. There's no harm that can come from like continue to ask your questions, going to your appointments to get yourself prepared because you have several things you have to accomplish beforehand. So you can have your questions, you're going to have your doubts, but as you move along, you realize there's not really that much to be worried about. And so it's really is just taking that step. It's the biggest step you'll ever take, and it's going to point you in the right direction to your weight loss journey and the happiness of your life.
Awesome. I think those are all the questions in the Q&A section. Dr. Dabbs or Bridgette, is there anything that you just want viewers to know or, anything that they should kind of take away from this presentation?
Mine is that you're not alone. There's people that have the same concerns and issues that you do. Your journey is going to be different than theirs, but you're still on the same journey. You're just branching out in other areas, but you will always have someone there to help you out, whether it's a patient or a nurse or a doctor. There's someone always that's going to be there to answer your questions or just be there to bend a ear or even to, hey, another patient, I live in the same area. Do you want to go walking or something like that? You're not alone. So.
Yeah, I think kind of piggybacking off of what Bridgette said and a lot of the other things that she said, I think that maybe people can have the idea that this is you come in, you meet with surgeon says this is a surgery that you get, here's your plan, get surgery, and then you're kind of very very sterile and clinical and sort of at that point we're kind of done with you. And that's not how this works if you're trying to do it well. I think that there are practices out there that do that. But I think the thing that I would want people to know is that there's just a lot more to it than the surgery. Obviously, surgery is like a big deal and it's scary. And anybody who I walk in the morning when I see people the day of surgery and they say that they're scared and they have this kind of sheepish look on their face like they shouldn't be. And I tell them, yeah, that's fine. That just means you're not crazy. Surgery can be scary. I think that the alternative of trying to live life into middle and elder years with the health problems associated with morbid obesity is a lot scarier, but it doesn't represent making a specific choice. And so I get how that's psychologically different. But it's not that stark, sterile, kind of unfeeling, cold experience. And I'd like to just take this opportunity to mention and kind of shout out Brandy, who's one of our lead, dietitians, and Kat, who is the nurse manager of our program, because everybody who makes this program work is, incredibly important, and their contributions since they joined our program have just been incredible on this side of it. I think that the patient care and day-to-day patient connection and follow-up has become so strong, and the benefits are very obvious. And so I wish that we had them here as well, frankly, because they're such a critical component to this program working.
Great. Thank you so much for both of you for all the information and just spending the time to speak to us today. If anyone watching joined a little late or just wants a copy of this presentation, you will receive an email with a link to our mountcarmelhealth.com website, which houses all of our webinars, so you'll be able to see this on there as well. But again, thank you so much, Dr. Dabbs and Bridgette, for joining us today. I really appreciate your time. I hope that you all have a great weekend and stay warm. Bye-bye.
Thank you very much. Stay safe.
Thank you.